My name is Professor David Leistner. I'm head of the Interventional Cardiology at Charité University Medicine Berlin in Germany. And I presented at the EuroPCR 2022 the primary results of the CRUZ-HBR study. So the aim of the study was to assess the performance of the ultra-thin strut Supraflux CRUZ stent in a large, broad cohort of all-comer patients with a certain number of about 1/3 high bleeding risk HBR patients. So we investigated the Supraflux CRUZ drug-eluting stent, which is an ultra-thin strut stent, drug-eluting stent with a strut thickness of about 60 micrometers, independent of the size of the stent, and it has a bioresorbable polymer which allows very fast healing of this stent device. So what we see that in this all-comer population, we see a favorable clinical outcome after PCI using the novel ultra-thin Supraflux CRUZ drug-eluting stent. This was non-inferior to the TALENT study, the randomized study, which leads to the use of the Supraflux drug-eluting stent in clinical practice. And for the HBR subgroup of patients within the study, we could show that the Supraflux CRUZ stent was non-inferior for the outcome with the endpoint DOCE device-orientated clinical outcome in HBR patients. So what we see now is that we have device-specific evidence for the use in a broad spectrum of all-comer patients for non-HBR as well as for HBR patients to use this novel generation of ultra-thin Supraflux CRUZ drug-eluting stent. And for my personal opinion, this is important for every new device to investigate such a device in the highest risk patients we treat every day in the cath lab, and these are HBR patients. As we see in CRUZ-HBR now, the CRUZ stent seemed to be a perfect solution for patients with high bleeding risk and very complex lesions. So the next step would be that on the one hand, you have to challenge this stent in only special situations, for example, CTOs, bifurcations, where this dedicated novel stent can optimize the results. And on the other hand, I think this stent opens the possibility to think again about minimizing the dual antiplatelet therapy. Maybe if you use such an ultra-thin strut stent, it could be enough to treat it after a very clear implantation procedure, to treat the patients only with one antithrombotic medication. But I think for this you need randomized prospective clinical trials, and I think they are actually in the phase of planning.